What's up guys, my name is Jada. Welcome back to my channel. So today I'm going to be showing you guys what's in my nursing clinical bag. Got a lot of fun goodies in here, so be sure to watch till the end. Also be sure to like and subscribe and let me know in the comments down below what you want me to do next. Without further ado, let's get into the video. So the first thing I'm going to show you guys is my bag itself. I got it from Amazon. It is super cute. It says coffee, scrubs, and rubber gloves. Some people just use their backpack for clinical, but honestly I think it's really helpful to have a separate bag so you got all your clinical stuff in one place and you don't have to unpack and repack your backpack every time you have clinical, which I had twice a week, so I feel like it would be very inconvenient to be like using my backpack, but to each his own, do whatever works for you. But this is the bag that I have, so let's open it. This is the first thing that I have and it is the most useful in my opinion. I have a clipboard and it is foldable. I absolutely love it. I use it so much. As you can see, I lost one of the rubber stoppers, but it's okay. I think it's really helpful to have a foldable clipboard because you're doing a lot of like stuff during the day. Like you're moving around, you're making beds, you're doing nursing skills. You don't want to just like stash your clipboard just like down in a patient's room or at the nursing station because it can get lost, it can get damaged, it can get germs on it, and you really don't want that. This is super helpful because it folds into a nice shape. It can fit into your scrub jacket or your scrubs itself if you have some deep pockets in there, which is super helpful in my opinion. Usually I print out a report sheet just like from Pinterest or like Google, it doesn't really matter. You can use whatever your school gives you or you can make your own. And that just helps you with like the assessment and like whatever they're saying in report if you listen to that what the nurses give it. I also usually keep a couple pieces of notebook paper with me just in case there's like any extra information I need. We did like a QI project this semester, so that's what I use a notebook paper for this year. But yeah, foldable clipboard is super helpful. I know some of the ones have like a nursing cheat sheet on the back. I didn't necessarily like miss that in mine, but there are also those, so you guys can use that as well. The next thing I want to show you guys is not something that I necessarily use in clinical, but I found it very helpful in clinical, and it is a blood pressure cuff. Let me open this here. So this is a manual blood pressure cuff. I found this so helpful because doing manual blood pressures is very difficult in my opinion, and my school, like last semester, we had to do a manual blood pressure every day. So we took vitals usually twice a day, and one of them had to be with a manual blood pressure, and I just for the life of me can never hear those sounds. So I bought this off of Amazon just to help me practice. It was like probably $15-20, not expensive at all. So yeah, I found it super helpful just to like practice on myself, practice on my roommates, my friends, just to like get used to hearing those sounds, because once you're used to it, you'll hear it better and you'll be able to do it in the hospital better. So I feel like it was really good for just like getting some good practice in. So yeah, if you also struggle with manual blood pressures, this might be a good buy for you. Next, I want to show you guys my stethoscope case. So this is the one I got. It is from Amazon. I thought it was super cute. It's a good way just to like know where your stuff is. I used to just like keep my stethoscope in my bag, which wasn't super helpful because it would get like all like mangled and misshapen. So I keep it in here so it keeps it shaped really well. Now I'm going to open it and show you guys my stethoscope. This is the one that I got, again, from Amazon. It was not super expensive. It was probably like $30. But like it's fine. It had like great reviews. I can hear the sounds really well, so it works for me. It definitely gets like, you guys can see, like it gets like a little bit misshapen, so if you want to splurge a little bit, get a more expensive one that you can use during your nursing career, you could totally do that. But I didn't necessarily miss having one of those more expensive stethoscopes. Like I felt like this worked for me, but if you want one that's more expensive, you'll definitely use it like throughout your nursing career. So to each his own. Next thing I have is my pen light. I found this super helpful. It's super cute. I needed it to look at like patients' pupils, looking at their mouth and nose, stuff like that. It also has pupil sizes on here, which I thought was really helpful because I don't know pupil sizes. I don't look at pupils on the regular. So it really helped me when I'm like charting, knowing like how big is 4 millimeters, how big is 2 millimeters, how like, what are the sizes of the pupils. So that's really helped me. I thought it was great. And then next I just have some alcohol swabs that I may or may not have stolen from my hospital. I think it's just good to like have some with you at all times because you're going to be cleaning your stuff all the time, especially if you have more than one patient, like cleaning off your stethoscope and stuff like that. So I thought they were helpful to have. Next thing, hopefully you guys won't have to use, but this is a face shield. I just have it because I had to use it. This is the one they gave me, but you can also get them off of Amazon. we had to wear these in our patient rooms, and they're kind of the worst. That was our hospital policy, but if you guys don't have to wear them, obviously you won't need them. They do make it harder to like talk to your patients, especially when you have older patients that like don't know what you're saying. Like having something that's blocking your face isn't the most helpful, but if you need them, then you need them. So this is what we had to use for COVID, but if you don't need them, then obviously you're not going to want to buy that because it's not necessarily super helpful. Next up, guys, I have my handy dandy laptop. Sometimes we weren't allowed to have our laptops, so check with the professor in your hospital and see if you are allowed to have them on the floor. On our like maternity floor, we weren't allowed to have them, but we could on our med-surg floors. And I mostly use this to like look up meds and to do like our case studies or care plans, whichever one you guys have. I found it super helpful just to like have that with me, so I could just be like typing it, writing it as I was going, as opposed to like jotting it down on paper and then transferring it to my laptop. It took way more time, so this I found super helpful. But make sure you check with your professor in your hospital to see like what you are and aren't allowed to do, because it really depends. So the next few things are not actually in my bag, but I use them in clinical a lot. So the first thing is this watch. It's just like a normal watch with a second hand. As you can see, I have a smartwatch, but it like goes off every few seconds. Like as you can see, it's dark right now. It turns on if I like move my arm, but if I just like leave it there, then it'll go off. And like if I have a second hand going, like second hand disappears, which is like not helpful if you're counting like respirations or like doing a heart rate manually. So you want to have like a watch where the second hands are going to like stay on the screen the whole time. So if you have a smartwatch where you can do that, then you can use that. But I thought it was really helpful just to like have a normal watch. It's not actually set to the time because I'm not great with telling time, especially when there's no numbers. But I thought it was really helpful just like for counting the seconds. So that's what I used. Next I have my water bottle. It is really helpful to have a good water bottle with you. You can also take a snack with you because you're in the hospital for like 6, 7, 8 hours, and I only have like 1 or 2 patients, but they will be like keeping you busy. Like there's a lot to do, and like the time gets away from you, but you have to make sure you're staying hydrated and taking care of yourself so you don't become a patient yourself. So this is my last item, and it is some good nursing clinical shoes. These are Skechers, and they're specifically slip resistant and they're water resistant as well. I thought they were really helpful to have. They are nice and comfortable. So you're going to be on your feet like most of the day. Like some of my professors didn't even let us like sit at the nurse's station. Like we had to find a computer elsewhere if we needed one to look up patient charts. So it is really helpful to have a good pair of shoes because you're going to be on your feet pretty much the whole day. Generally they have to be black or white, so I bought black ones because there's lots of bodily fluids around in the hospital and I didn't want mine to get stained, but people have white ones as well, so whatever works for you. And that is all the things I take with me to clinical. I hope you liked the video. Be sure to like and subscribe and comment down below what you want me to do next. I will see you guys in my next video. Bye!